Can everyone hear me? If I just... So, my name is Josh Gril. I'm the director of UCI-Mind and an Alzheimer's disease researcher at UC Irvine. This is my colleague, Robin Lee. Robin oversees much of our efforts to involve the Asian American community in our research. I'm going to speak in English. Robin is going to translate into Mandarin. How many people speak English? And almost everybody. And how many people prefer Mandarin? Okay, a couple. So we will certainly do that. I want to begin by saying thank you for the opportunity to come today. I also feel compelled to say how sorry we are for what happened here, that we understand how traumatic it must be for your community, that our hearts and thoughts and prayers are with all of you, and that we consider ourselves part of this community as well. And we are saddened by unspeakable things that happened here and have continued to happen elsewhere in our country. We are not going anywhere. We are part of this community. We value this community, and we are happy to do anything we are able to help you move forward, as we understand that will be very difficult, but we will be here for you to do whatever we can to help. That was a lot. You want to just share the sentiment?
大家能听懂吗？好像我是从这儿出来的哈。好，那么 Dr. Gril 大家过去也认识也见过了哈。那么我们呢就是从 UCI-Mind 就是 UCI 的记忆缺失和神经疾病研究所。那么他呢是所长，就是我们的主任。那么就是基于上一次发生的事情呢，我们觉得非常遗憾，而且我们呢是跟大家在一起我们希望呢我们能支持大家，我们不会离开这个地方的。那么我们呢和大家在一起，你们呢在我们的心当中，那么我们就为大家祷告。
Life will never be the same, but life must go on. And we are going to continue what we believe to be our good work in partnership with our community, and we're going to tell you a little bit about that work today.
好，那么生活呢不会停止，不管发生了什么事情我们还是要继续向前。我们呢就是整个社区的一部分，我们跟大家一起。那么我们在做什么呢？我们会给大家介绍一下。
So, our presentation is relatively brief today. We will go through this agenda to update you about what we have learned about Alzheimer's disease and other causes of dementia in recent years, how we now are better able to diagnose these diseases than ever before, and we'll talk about some advances in treatment which we acknowledge are controversial.
好，那今天的讲解呢，主要呢就是我们让大家知道一下我们最近有一些什么进展在这方面的一些有些什么进展，而且呢我们在做一些什么具体的那么还有一些尽管是有争议的，就是一些新药的出现。
We will leave time for questions, and we want to answer any questions you may have about our work. And I want to say that part of our mission to make these discoveries, to advance the way we treat, diagnose, and even think about these diseases, is to ensure that all people will benefit from our work, to ensure that all people are represented in our research, and we'll close by talking about that important aspect of our mission.
好，那我们的使命呢，最重要的一个呢，就是让我们所做的研究，就是让所有的人都得益于我们的研究。那么我们最后呢，会讲到这一部分啊，我们怎么来做？那么为什么我们要让所有的人都得益于我们的研究？
So to get us started, the single most common question we get is what's the difference between Alzheimer's disease and dementia? Dementia is an umbrella term. There are many diseases of the brain under the umbrella that can cause dementia. And Alzheimer's disease is the most common disease of the brain that causes dementia.
好，我们最常碰到的问题呢，就是大家问哈，那么从中文上我们讲什么是失智，什么是老年失智，就是 dementia 和 Alzheimer 老年失智和失智。那么失智呢，像一把伞一样，我们看到它是就是一个大的一个术语。那么在这个里边呢，失智呢是可以有很多不同的原因引起的。那么老年失智就是我们说的阿兹海默症，这个呢是引起失智的最主要的原因之一。
We refer to dementia as a syndrome. It means that a person has problems with thinking that prevent them from living life the way they once did.
好，那么这个失智呢，它是这个一组这个症状啊，就是由于他的失智呢，已经影响了他的生活，影响生活了，所以我们才把它定义为失智。
Alzheimer's disease refers to the changes in the brain that result in those problems with thinking.
啊，那么老年失智或者是阿兹海默症，它呢就是大脑的变化，由于大脑变化，那么使得出现了这些失智的这些症状。
Not surprisingly, the disease was first characterized by a famous psychiatrist named Dr. Alzheimer. And he actually followed a particular case pictured here, August Dieter, as she developed thinking problems and ultimately succumbed to her disease. She died of her disease, and he even examined her brain and published the first paper on the disease that would later take on his name in 1906.
好，那1906年，这个阿兹海默，这个是他的姓啊，阿兹海默医生，他是德国的。那么他发现了这个第一例病人，那么大家看到画里边的这位病人，那么他最后呢，就是由于他大脑的这种变化，最后呢，这个疾病呢，这个医生跟着他研究，最后呢，还把他的大脑也做了解剖，看了。然后呢，这个病呢，就是以他的姓来为命名，叫做阿兹海默症。
So we've been studying Alzheimer's disease for more than 100 years, which sounds like a long time. But in fact, we are still in our infancy as a field. We've been studying heart disease and cancers for hundreds of years, and only recently have we entered a modern age of Alzheimer's disease research.
那么就是从阿兹海默医生那个时候开始到现在已经100多年了。虽然这个时间很长，但是呢，实际上比起心脏病和癌症，那么我们对于这个疾病的研究呢，还是属于幼儿时期。
And in fact, we are still studying many of the things that Alzheimer himself first noted about August Dieter's brain when he examined it after she passed away.
那么事实上呢，我们现在仍然在研究，就是当时阿兹海默医生所发现的，他所研究的这个疾病为什么产生，我们现在仍然是研究的是这个方向。
This cartoon illustrates the changes that happen in the brain of a person with Alzheimer's disease, starting with healthy cells, then moving toward the accumulation of abnormal proteins inside of the brain that cause the brain's nerve cells to become unhealthy, to not function properly, and ultimately to kill those cells, the connections between those cells, and result in the progressive cognitive worsening associated with this disease.
那么这幅图画呢，我们看到了，就是大脑里面从一个健康的大脑，它的细胞健康的，那么中间经过了什么变化？细胞呢产生了坏死，那么最后呢，到大脑被这些不正常的蛋白质都被它糊起来了，所以呢，最后呢，那么就人呢也表现出来一些智力上的一些变化。
Now, of course, we have learned a great deal more than Alzheimer did more than 100 years ago. We now understand the molecular changes, the genetic underpinnings, the cellular changes in the brain at whole new levels, and later we'll tell you about how these discoveries have even led to advances in treatment and diagnosis.
好，那么当然比起阿兹海默医生来呢，我们现在呢就是从分子结构的水平，还从这个遗传学的结构上呢，我们发现了很多的就是这个病因的产生。那么我们会把这些呢在后面的讲解里面告诉大家，我们怎样应用这个我们所学到的知识，那么怎么来发明或者是发现一些药物。
We've also learned a lot about who is at risk for Alzheimer's disease.
那么我们还学到了很多，就是哪一个人群，那么它的这个风险性是最高的。
Now, the strongest risk factor for Alzheimer's disease is age. And so my number one recommendation is always, please stop aging.
好，那么最大的风险因素就是年龄增大。那么我的第一个建议呢，就是大家不要成长了，不要。
After age, we know that the genes we inherit from our parents impact our risk, but it does not completely determine it. Only about half of the risk for Alzheimer's disease is believed to be inherited through genes from our parents.
好，那么第二个原因呢，就是我们从父母亲那儿有些基因的，我们接受来的基因。那么这个呢是，它不是说一定你有这个基因，你就一定会患这个疾病。那么有一半左右的人是受基因影响。
The other half of the total risk for Alzheimer's disease is what we would call environmental or lifestyle related. And this includes things that increase our risk for getting Alzheimer's disease, like high cholesterol and high blood pressure, but it also includes things we can do to lower our risk, like getting exercise, eating a healthy diet that includes fish, dark green leafy vegetables, and berries that are rich in antioxidants.
那有一半的呢，我们可以归于是环境因素或者是生活方式的因素。那么这个环境生活方式的因素呢，就是我们是有些因素呢是可以控制的，比如说我们的高血压，高胆固醇，那么这些呢是可以控制的。
So every person should strive to lead a brain healthy life, lowering the things that put us at increased risk and enhancing the things that lower our risk.
那我们每一个人呢，我们希望每一个人呢都能够就是加强改变自己的生活方式，保持一种健康的，就是对大脑好的健康的这样一种生活方式，而且呢要除去那些不健康的生活方式，降低我们这个病的就是风险因素。
Unfortunately, I cannot give you a recipe to make sure that you will never get Alzheimer's disease or other forms of dementia.
那么不幸的是，我就没有一个菜单，就是给你，那么你就照着这个菜单呢，你可以不得这个病的。就是不幸的是，没有这样一个菜单。
We have people in our studies who did everything right, exercised, challenged their brain, high education, healthy diet, but still got Alzheimer's disease.
那么在我们所研究的人群里面呢，有一些人呢，就是说他什么都做对了，锻炼身体，饮食也做对了，而且呢也跟踪自己，让自己就是这些疾病啊都受了控制了，他也受了高等教育，但是呢，他还是得了这个疾病。
And so research to improve diagnosis and treatment and ultimately we hope prevention is critical.
那么就是在我们的研究当中呢，就是早期诊断、早期预防就变成是非常非常重要。
We believe that early diagnosis is key to clinical practice and to our research.
好，那么我们认为呢，就是早期诊断，那么对于临床和研究来说都是非常重要的。
Some people and even some doctors are nihilistic. I don't have a cure. Why should I make the diagnosis?
好，那么有些人呢就有这样的想法，就是说，既然没有你治不了我的病，你不可能有治病的治不了这个病，那么我为什么要去知道这个诊断呢？
But we believe early diagnosis is very important. The burden on the individual and the family of Alzheimer's disease is great, and the need for planning is equally great. And with early diagnosis, the opportunity to make not only the strongest plans possible, but to involve the person with cognitive problems while their cognitive performance is at its best is very important.
那么从我们来讲，为什么说是这个诊断非常重要呢？就是早期诊断，对这个计划，因为这个是一个很长期的一个计划。那么因为照顾阿兹海默症这个疾病，对于家人、对于本人来说，都是一个很沉重的一个负担。如果我们能够就早期计划，那么病人本人呢，在他还能够参与计划的时候，他能够尽最大的力量让他来参与这个计划。那么我们可以把这个计划尽可能的定得详细一些，好一些。
Because this is a progressive neurodegenerative disease, we also believe that with better treatments, earlier diagnosis will be even more important to intervene while the brain is as healthy as possible to slow the progression of the disease or perhaps stop it.
还有一个呢，就是因为这个是一个进行性的疾病啊，就是它没有回头的，就是一直在变坏。但是如果你早期诊断，那么你有一些办法，至少呢可以把这个疾病的进程呢降慢，就是放慢下来。好，这个呢是一个非常重要的，对早期诊断来说。
And in fact, many of the treatments we are testing now are being tested in as early a disease stage as possible. And so early diagnosis may be key to people participating in those clinical trials. We now even have clinical trials that aim to test interventions before the onset of memory problems as a way to try to prevent a person from ever getting dementia.
那么这个早期诊断跟我们早期进行这个临床研究呢是联系在一起的啊。那我们现在的诊断呢，就是可以看到很早期，就是在有些呢是病人呢还没有出现他的一些就是认知方面的症状、智力方面的症状的时候，就已经开始进行一些措施。
So what's involved in the diagnosis of dementia due to Alzheimer's disease or another cause? First and foremost, you need to find a clinician who understands the aging brain.
那么诊断呢，我们有些什么步骤呢？第一个步骤呢，就是一定要找到一位医师，那么他对于整个疾病呢，他是有很多的知识，可以来跟你谈这个问题。
This may be your primary care physician, but we find often to get a good diagnosis, patients must seek out a neurologist, a psychiatrist, or a geriatrician.
好，那么当然了，你可以跟你的家庭医生谈，但是呢，很多情况下呢，我们发现需要做一个比较确切的诊断，那么你要看一下你的神经科医生，或者是你的精神科医生，另外呢，还有就是老年科的医生。
that skilled clinician should take a thorough history to understand the cognitive performance over time of the individual.
那么这个医生呢，他就是首先呢，第一一定要看一下整个病史，详细的看一下病史。
They will use several tests to rule out other causes of cognitive problems, in particular, things that are more amenable to treatment.
好，那么他们首先呢，就是要用排除的方式，就是你的这些智力方面的问题，那是什么引起的呢？要先排除一下，就是这些呢不是阿尔兹海默症引起的，所以就排除的是非常重要的。
This will include blood laboratories to look for infections or vitamin deficiency.
好，那么这个呢是包括，也就是验血，那么要排除你的维生素缺乏，或者是有感染这样一些因素。
It often includes imaging of the brain to make sure a person hasn't had a stroke or other problems.
还有呢，就是要大脑的一个照片，我们说的一些就是影像。那么这个呢要排除一下，看看他这个人呢是不是有中风或者是其他的脑部的一些病变。
And at places like UC Irvine, it often includes referral to what's called neuropsychological assessment to more thoroughly understand the cognitive changes that have happened in the person suffering from these problems.
那么其中的一个重要的测试呢，就是一个我们说的神经心理方面的测试。那么这个测试呢，就是测试出你是处于哪一部分、哪一种问题。
Now, we also have new tools that help rule in Alzheimer's disease as a cause of cognitive problems.
好，那么现在呢，我们还有新的一些工具、新的一些方式，那么来查一下到底是不是阿兹海默症。
Some of these will likely be in the news in the next 2 weeks.
好，那么大家可能会在新闻当中会看到一些这是一个新的方式方法。
There are new blood tests that seem to be relatively good at detecting if a person has the changes in the brain associated with Alzheimer's disease.
好，现在就是新的血液检验的方式，新的方式出现，就是看起来呢是比较有希望，就是比较有前途的这个血液检验，就是看看它是不是阿兹海默症有关。
These are still quite new.
这个呢是非常新的
As of today, the only one available clinically is also quite expensive and not covered by insurance.
那么现在呢，就是说它可以有这样的方式的，但是呢，你的保险非常贵，保险呢不会覆盖。
But this may change in the coming weeks, and new tests of the blood that are actually much cheaper. I don't know whether they'll be covered by insurance, but much cheaper may become available.
好，那么这个呢可能是变化的，随着研究大家这个发展那么今后呢，就是下一步呢可能会比较便宜，而且呢，你的保险也可以 cover。
These tests aim to give information about the brain that would otherwise require something called a PET scan.
好，那么这个呢，就是说对比起来有一个就是正电子扫描说那个，那么就是说用血液来检验呢，更加直接，更加简单。
The PET scan is a picture of the brain taken after injecting a drug into the blood that shows us whether the plaques that accumulate in the brain of a person with Alzheimer's disease are present.
好，那么这个正电子扫描这个呢是需要注射一种溶剂，那么注射进去以后呢，那么在你的大脑里面显现出来，它用颜色表现出来，是不是有不正常的蛋白质在你大脑里面积淀下来。
The PET scans are the gold standard upon which the blood tests have been developed Unfortunately, the PET scans are also very expensive and not covered by insurance.
那么这个正电子扫描，它的目的呢，就是现在我们所做的血液需要达到这样同样的目的。但是呢，正电子扫描也是很贵的，而且呢，一般情况下，这个保险也不会 cover。
Work at UCI aims to change these things, to make these tests available, to demonstrate their utility, and to try to convince Medicare and private insurers to pay for these tests.
那么我们在 UCI 呢，我们所做的研究呢，我们是想跟 Medicare 证明我们在做这些，那么希望他们能够把它用在病人的诊断里面，而且呢把这个降下来。
Only time will tell if we are to be successful, but many believe that the only thing that will result in coverage for these tests is the development of treatments that lower the burden and cost of Alzheimer's disease.
好，那么我们是会看到希望，但是呢，很多人相信呢，就是说，我们呢为什么可以降低？如果能够降低治病的成本，那么这些呢，我们就可以做到。
Now, for many years, there have been FDA-approved treatments for Alzheimer's disease, and they are listed on this slide.
好，那么这个我们现在看到的呢是过去的这几十年里面，那么 FDA 就是药物食品监察局批准的一些药物来治疗这个阿兹海默症的药物。
All of these treatments were demonstrated in people with Alzheimer's disease dementia to improve their symptoms when they were taking the drugs.
好，那么这些药呢，它只是针对一些症状，就是有这个疾病的人，那么他的症状呢会有所减轻。
Some were approved in mild to moderate Alzheimer's disease. That includes Razidine, Aricept, Exelon. Some were approved in moderate to severe Alzheimer's disease. That includes Namenda and Namzaric. Namzaric is just a combination of Aricept and memantine, Namenda. Aricept has been approved in mild, moderate, and severe. Sorry.
好，那么这些药呢，就是有些呢，它是被就是说批准呢，是用于轻度到中度的阿兹海默症，就是前面这三四个。那么有些呢是中度到重度的，还有一个呢是两个联合起来，把两个药合在一起用的。
None of those medications have been shown to slow the progression of the disease, and none have been approved in mild cognitive impairment, meaning a person has memory problems, but they don't affect their function or activities of daily living, and none can prevent Alzheimer's disease or dementia.
好，那么这些药呢，就是所有的药，我们把它总起来说呢，都是没有哪一种是可以减缓这个疾病的速度，也没有哪一种是可以用来治疗就是轻度认知障碍。我们说的轻度认知障碍是这样，轻度认知障碍呢，就是说你有一些认知障碍了，但是呢，它还没有影响你的日常生活，但是呢，这些药呢，都对你都没有作用。
I want to stress, these drugs help. They are used because they help. They just don't do what we need. We need drugs that stop the disease in its tracks or bring people back to where they once were.
那我知道这些药它们是有帮助，因为用了这么多年啊，那是因为它有帮助，所以它就一直存在。但是呢，我们的目标呢是希望呢能够治好这个疾病，就把它停下来，不要再继续病了，或者呢把这个已经生病的人呢回到正常，这个呢是我们的希望。
And so there has been incredible activity and effort toward developing better treatments for the last 20 years.
所以过去的20年呢，就是就是各个不同的这个涉及到这个疾病的这些机构啊，都在想办法发现 最好的药物来治疗这个疾病。
And in 2021, the field had a milestone.
那我们要讲的是，就是去年2021年，那么我们这个是到了一个里程碑，通过这么多年20多年的努力，啊，那么这个里程碑是一个什么样的呢？我们再看一下。
A new drug for Alzheimer's disease was approved for the first time in 15 years. That drug is called Adicanumab.
好，那么这个新药呢，中文里边呢，它没有，就是把这个化学名字翻译成是阿杜卡努单抗。那么这个药呢，就是10多年来就一直没有出过新药。那么这个呢是出现第一个10几年来。
Adicanumab, or Aduhelm, is a drug that directly targets the plaques that accumulate in the brain of a person with Alzheimer's disease.
好，这个阿杜卡努单抗呢，它的作用呢，就是说直接作用于这个大脑里边这些非正常的这个蛋白质、淀粉蛋白质的这个沉积。
This is a picture. Oh, you can't see my mouse. The picture on the right is what a PET scan looks like measuring beta amyloid. And on the left is what a scan of a person with Alzheimer's disease would look like. And on the right is what happens after treatment with aducanumab. The amyloid levels in the brain can be lowered, actually, to normal.
好，那么刚才的这个图呢，是我们看一下哈，这红色的呢，这个呢是这刚才讲到的这个 PET scan，就是这个正电子扫描。那么他看到的就是大脑的这个蛋白样淀粉沉积在这个有阿兹海默症这个疾病这个人的脑子里。那么右边这个呢，就是说在经过了一段时间的这个用这个药以后呢，它是清除的，那么它甚至可以清除到正常的这样一个程度。
Aducanumab is an antibody against the protein that accumulates in the plaques.
好，那这个药呢是一种抗体，这个抗体呢专门针对这种淀粉样蛋白在你大脑里边沉积。
We all got vaccinated against COVID-19 to help our body create antibodies against the virus. Antibodies may also be helpful to fight against what's happening in Alzheimer's disease, though it is not caused by a virus.
好，那么就举个例子，我们大家都接种了，然后呢，我们防御或者是我们这个疾病哈 ，COVID-19， 但是呢，这个抗体呢也可以在你的大脑里面，就是来制止，或者是怎么样这个淀粉，但是呢，你这个淀粉的沉积呢，它不是病毒。
Adicanumab goes to the brain, grabs the plaques, and acts as a signal to help them be cleared from the brain.
好，那么这个阿姆卡纳这个抗体呢，进到大脑子里边呢，它就是跟这个结合起来的淀粉，然后呢把它清除掉。
The first study that showed this was a big deal. It was on the cover of the very famous journal Nature several years ago.
那么最先的发现这个呢，是在我们的杂志《自然》杂志，这个杂志是非常著名的一个科学杂志，上面的封面就谈到这个问题。
But what was still unknown was whether this was enough to slow the progression of disease or help people do better.
好，它起到了清除这个淀粉沉积这个作用。但是呢，我们现在还不知道，那么它对这个认知、智力这个变化，那它会不会有作用呢？
And so the company that makes aducanumab did 2 very large clinical trials to test its efficacy. Can it slow progression of Alzheimer's disease? And the results of those clinical trials were very controversial.
好。那么这个公司就做这个药的公司呢，它有2个不同的实验哈。那么 就是说看一下到底它起不起到作用，能不能对智力方面的这个起到作用。但是呢，这两个出来的结果呢是非常就是有争议的。
I won't belabor the controversies, but the trials were stopped early because the sponsors thought they were not likely to succeed. They then decided they were wrong, and that one of the trials demonstrated a benefit of Adicanumab, and that the other did not.
好，那么这个过程呢，就是他们这个就是没有按照计划进行到底，他们在中间就已经把它停掉，他们觉得好像没有什么效果。但是后来呢，他们重新看他们的这个资料呢，才发现其中的一个实际上是有一些效果的，其中的一个实验。
An independent panel of advisors to the FDA voted uniformly against full approval for Adicanumab.
好，那么就是一个独立的一个机构，那么他们呢实际上是不赞成，就是这个食品药物研究所来批准这个的，他们不赞成。
And the FDA decided to approve Adicanumab under something called the accelerated pathway.
但是呢，这个药物食品研究所呢就决定他们还是要批准，但是呢它是有一定的条件的。
This means that the FDA approved Adicanumab because, they said, it had been convincingly shown to lower amyloid plaques in the brain, and this was reasonably likely to produce a clinical benefit in patients treated with the drug.
那么他们批准这个药物的主要原因，就是因为确实是已经看到它的效果，就是说大家看到刚才那两张图的对比它可以清除这个蛋白质沉积在大脑里面。虽然说不知道今后就是对这个智力方面有没有，但是呢，它确实有那个作用，就是清除这个蛋白质。
There remains great disagreement in our field about that last part, about whether lowering amyloid is reasonably likely to produce a clinical benefit in patients treated with this drug.
好，那么现在关键的就是在这个研究领域里面，这个争执呢，就是说它清除了这个蛋白质，但是呢，它能不能就从临床上来起作用呢？就临床作用就是让你的症状消失，或者症状不再变坏啊等等的。就是一个呢是清除，一个呢是有没有临床效果。
Since the FDA decision, the Centers for Medicare and Medicaid Services, CMS, have decided they will not cover Adicanumab. And Biogen, the maker of the drug, has actually decided they won't market the drug. So it is approved, it is not being used very much at all. There were many other controversies that we can talk about later if anyone's interested.
好，那么尽管是 FDA 它批准了，但是呢，我们的这个 Medicare、Medicaid 这个机构呢，它就是不会来付这个你用药的，它不会给你付，所以呢，这个药物公司呢，它也没有大批的做广告啊，就宣传这个药，所以这个药的使用呢，还是一个问题。
I do believe this was an important milestone for the field, but we still have a lot of work to do.
对我们来说呢，在这个领域里面确实是一个里程碑，但是呢，我们还有很多工作要做。
Perhaps drugs that can lower amyloid in the brain will be key to slowing, stopping, or reversing Alzheimer's, but maybe we will need more than one drug to achieve that goal, and having an approved therapy, and others are likely to be approved this year, that can also lower amyloid, could be an important step toward testing cocktail therapies for Alzheimer's disease.
好，那么这个药呢，也许呢，它能够，就是说它清除了这个蛋白质以后，它能够起到临床作用。但是呢，还有其他的研究的新药也正在出现。那么也许我们需要一种或者是两种或者是两种以上的药来治疗这个疾病。
At least 4 drugs have now been shown to lower amyloid levels in the brain. Many may get the same accelerated approval this year. At the end of the year, we'll hear readouts from clinical trials to see if any of the other drugs can actually slow the progression of disease, which could result in full approval and perhaps coverage by insurers.
那么其他的还有4个公司，其他的还有4种药也是同样的，能够就是清出这个蛋白质的沉积。那么这些药呢，可能在今年年底的时候呢，可能会陆续被批准。那么希望呢，就是能够批准的时候呢，希望临床效用呢，我们已经看到它确实起到了临床作用。
But again, even if any of those drugs get full approval, it's unlikely that they will stop Alzheimer's disease completely. And so we will need to test new targets, combination approaches, and we have made many discoveries yielding potential means to intervene in the progression of this disease to try to slow, stop, or reverse it.
好，那么尽管这些药批准了，但是呢，我们还不可能说是这个药呢就可以停止这个疾病就可以完全治好了。那么还有其他的方式、其他的路子，我们还在继续研究。
And at UCI-Mind, we are testing some of these other treatments now in clinical trials. We are developing new treatments in the laboratory. Our organization's mission is to find ways to help people not suffer from Alzheimer's disease.
好，那么在 UCI 呢，我们实验现在已经有了这些方式，那么我们还在继续发现或者是发明一些新的方式。那么我们的宗旨呢，就是帮助大家不要再受这个疾病的干扰。
And for many of these studies, and for many, many other studies, one of the single most common barriers to our success is low rates of participation in research.
那么在我们的这个研究当中呢，最大的一个障碍呢，就是参与的人数太少，参与的人数不够。
This is true not only for Alzheimer's disease research, it's actually true for all areas of medicine. The single most common reason that clinical trials fail is inadequate participation.
这个呢，不光是我们阿兹海默症这个研究了，就是所有的其他的研究啊。那么就是唯一的一个为什么研究会失败，那么主要的原因就是没有足够的人来参与。
And as I said at the beginning, we are committed to inclusive clinical research. Alzheimer's disease and other causes of dementia know no racial, ethnic, or socioeconomic boundaries. These diseases affect all people.
我在开始的时候我们就讲到了啊，就是我们希望就是我们的研究成果呢，为所有的人都带来福音。那么就是说这个疾病呢，它不会区别我们的种族方式啊，或者是我们的社会层次啊，任何人都有可能有这个疾病。
And we want to find solutions for all people. And the only way we will know that the solutions we discover work for everyone is if everyone is enrolled in the research to make those key discoveries.
我们希望它能够对每一个人都有益，但是呢，反过来呢，也希望所有人呢都能够参加进来，所以呢，才知道这个研究的成果对这一群人或对那群人有益。
In this country, essentially all people who are not affluent, well-educated, non-Hispanic whites are underrepresented in research.
好，那么就是在美国，在我们这个国家啊，那么就是少数族裔，那么就是在这个研究当中呢，就是它的代表性呢是很小的。
For example, the proportion of participants in Alzheimer's disease clinical trials who are Asian in North American studies is probably around 1%.
好，那么这个例子呢，就是一个很惊人的，就是亚裔啊，参加阿兹海默症这个研究的呢，只是1%，1%。
And so we are committed to trying to change this, to try to study all people, be inclusive of all people in our research.
那我们希望呢，就是我们能够包括所有的人都来参加到我们这个研究当中来。
And we have many studies and initiatives that are trying to change this. One is on this slide. It is a collaborative effort with the University of California at San Francisco, the University of California at Davis, USC, UCI, and many, many community partners. And it is called the CARE Registry.
好，那么我们这儿呢有一个研究登记是以UC San Francisco 牵头，那么其他的很多的 UC 大学，包括 UCI 在内，那么参与到这个里边。
The CARE Registry has the goal of enrolling 10,000 Asian Americans and Pacific Islanders, mainly in California, but not exclusive to California, so that they can be available to participate in studies if they wish. It is not an obligation. It is confidential. It is free, and in fact, people are given a $10 gift card for enrolling, and it is being performed by academic investigators at places like UCI.
好，那么这个项目呢，就是计划呢是要招募1万名亚裔和太平洋岛民那么参加到这个里面来。那么这个就是一个我们叫它研究登记。那么就是你不是说是你必须一定要做，那么你进来以后呢，如果你觉得适合了，研究人员找到你了，你觉得适合了，你可以参加。这个呢是当然是就是不会有什么消费，而且呢每个人可以有10块钱的感谢你的时间，感谢你的精力。
And so it's low risk, low burden, and we are asking our community partners to consider enrolling so that we have adequate representation in research. If you enroll in the CARE Registry, you spend 10 minutes on a website and you are agreeing to let researchers let you know about new studies that might be surveys or telephone interviews or going to a place like UCI-Mind to participate. You will always be invited but not obligated. You are always free to say no or to remove yourself from the CARE Registry entirely. There are few risks.
好，那么这个加入到这个研究登记呢，就对你来说没有任何冒险，没有任何风险你参加了以后呢，如果研究人员跟你联系，那么你可以同意，你可以不同意，你觉得合适你了，那么你就参加。那么这些研究呢，可能是简单到只是问你几个问题，或者做一个调查问卷。或者呢，你就参加一个研究，那么这些都是取决于你自己的决定。
I believe the risks are far greater in research continuing to fail to represent the many people who need our help and whom we wish to help.
好，那么我们这个研究，它如果失败了的，那么最重要的原因呢，就是说我们没有能够把大家都邀请来做研究，那么这个就是我们的失败。如果我们不能够这样做。
And so we hope you will consider this. We thank you for opening your doors and your minds to us, especially at this difficult time, and we're happy to take your questions.
好，那么我们谢谢大家的时间谢谢大家来听我们讲。下面呢是我们回答大家的问题。
For the new drugs, which can clean up the plaques that you introduced to us,
Yes?
are there any side effects for taking them?
Yeah. So the question is, and then maybe you can repeat it after me. So I'll do it first in English and then you do it. Okay. So the question is, for the new drugs that clear the plaques from the brain, are there any side effects?
好，那么就是这个新药，刚才谈到这个新药它可以清除你大脑里边这个蛋白质沉淀。那么它的副作用有哪些？
And the answer is yes. All drugs have side effects. And the question is, how severe or significant are the side effects? And is the risk justified by the potential benefit? Now, the drugs that clear the plaques from the brain all seem to produce a side effect that we call amyloid-related imaging abnormalities, or ARIAs. Sorry about the jargon. But basically, pulling the amyloid out of the brain can leave the blood vessels of the brain structurally at risk. And so we see some diffusion of fluid, or what we would call swelling, in the brain, and less often we can see bleeding in the brain. Sorry, this is a lot. Go ahead.
OK， 好，那我就简单说呀，就是这个呢，就是因为你那个药进去以后呢，你要把那个蛋白质要清出嘛哈，所以它对那个脑血管有一些影响。那么我们看见的就是有一些轻度的水肿，有少数的呢可能有一点淤血出血。
How often this happens differs from drug to drug. It actually seems relatively high in frequency for Adicanumab and is likely to be lower for some of the other drugs that are coming. But it is real for all of the medications.
好，那么就是说是哪一些药，比如说是影响比较大一些呢？就是我们刚才讲这个是阿布卡度单抗，这个看起来好像要出现的要高一点，另外的一些药呢稍微要低一点。
Most of the time that it happens, it does not cause any symptoms, and it goes away on its own.
就大多时候呢，你感觉不到的啊，只是在影像里面可以看到，但是人是自己是感觉不到的。那么一段时间以后，它就消失了。
The only reason we knew it happened is that in the studies we were doing MRIs that allowed us to see it. And so when these drugs begin being used, people will have to have MRIs to check for their safety.
好，那么用药我们为什么会知道有这种现象呢？就是因为我们要用那个 MRI， 就是来那个影像来监察啊，你用了这个药以后，那么要照这个片子来看。
Neurologists, psychiatrists, geriatricians in our field, and I agree with them, believe that this is a manageable side effect if a drug can slow the progression of disease and perhaps prevent people from getting to severe stages of dementia when they're completely dependent on others for every aspect of life, including feeding, bathing, toileting.
好，那么就说比起让这个疾病进到很严重的程度哈，那么让大家他整个生活都依靠别人，那么比起那个结果来说呢，就是这个副作用，那么就是所有这个专家们认为哈，这个副作用呢是可以控制，可以在我们的控制当中的。
Now, also importantly, the PET scans and our use of those PET scans in research showed us that plaques build up in the brain years, perhaps decades, before memory problems begin. We are now testing those drugs as preventative therapies for Alzheimer's disease. Can we get rid of the plaques before the memory problems begin, and will that stop the memory problems from ever happening?
好，那么就是我们说那个 PET scan 哈，因为它呢已经表明了哈，就是说在我们的这个临床症状还没有出现之前，实际上这些蛋白质已经在我们大脑里边很多年了，20年、10年、15年、30年哈。那么如果这些药能够让我们在症状还没有出现之前把这些清除掉，然后呢就不会出现这个症状，那么这个呢就是一个我们研究的一个目标。
These are very exciting, aggressive studies, and they are happening now. At UCI, we are testing a different antibody called lecanemab in people who are older and have normal memories, who have a scan to see if plaques are building up in the brain, and then are randomized to lecanemab or placebo and followed for 4, probably more years to see if we can stop them from getting memory problems.
好，那么 UCI 呢现在有一个具体的一个临床研究哈，就是我们用另外一种药也是单抗啊， 那么就是在我们的研究人群呢，是他的大脑里面已经有这些成绩，蛋白质成绩，但是呢，他没有表现出这个临床症状来。那么我们跟踪他们4年5年，看看把这些东西清除以后，是不是能够就是让他们不要发展那个临床症状，不要有这个质出现的。
And I'm aware of at least 2 other studies that we're not a part of, testing Dynamab and Gantenerumab that'll look at the same hypothesis and are open to enrollment now.
那我们就是我们学校虽然没有参加，但是呢，另外2个同样的机制的这样一个研究，他们也在招聘，也在进行。
And at the end of this year or early next year, we'll actually learn the results of the first ever study like that. We have 20-some people who've been participating with us for some time between 4 and 10 years in the first ever trial aiming to test an anti-amyloid therapy. It doesn't clear the brain of plaques, but it targets the plaques and tries to minimize their impact. And we'll learn the results of that study in the next 6 to 9 months, which will also be very exciting.
好，那么在今后的6到8个月中间我们可能会公布一些研究的一些结果。那么这些跟我们一起研究的人呢，已经是4年到10年了。那么这个呢，是一个非常激动人心的一个结果会出来。
And in all of these studies, it's important that the populations who participate are as diverse as the populations we wish to help.
那么就是说，我们希望呢，就是参加这些研究的人，能够就是所有不同的族裔的人都会包括进来，那么才能够对他们有利。
Interestingly, Asians may be a little lower in risk for Alzheimer's disease compared to non-Hispanic whites and Hispanics and African Americans. And that is probably because the greatest genetic risk factor for Alzheimer's disease is lower in prevalence in most Asian communities.
好，那么就是说，刚才大家听了就都觉得，哎呦，很高兴啊，因为亚裔就是比起那个我们说的白人还有Hispanic 还有黑人这些呢，好像是要稍微低一点，大概是因为我们的基因里面有一些成分在里面吧。
But Alzheimer's disease and dementia are still major problems in Asian communities in the United States. And older Asian Americans are among the fastest growing segment of our national population. So though the risk may be slightly lower, we don't truly know why that is. We would like to. We want to learn so that we can find ways to help everyone. And we know that dementia is still a major problem in the Asian community that requires better care, better resources, supportive services, and better research inclusion to discover solutions for all.
刚才提到这个，但是呢，我们不知道原因为什么，所以呢，我们希望呢能够就是来研究这个Asian American， 就是我们的亚裔大家来够参加，能给我们更多的信息。
And we have a long-standing study at UCI called our observational study, where people come in once a year to have their memory tested. They are asked to give blood. We have taken skin cells for generating stem cells. Many people undergo neuroimaging, and some give cerebrospinal fluid through a lumbar puncture, all for the sake of studying natural aging and disease aging over time. We are the single highest proportion of participants nationally from Asian communities.
好，我们的长期跟踪研究，我看在座的有几位都是参加我们的长期跟踪研究这个项目。那么这个项目呢，就是说你每年来一次，那么做测试，做完了以后呢，我们跟踪你给你一个报告，看你今年怎么样，明年怎么样，后年怎么样。那么我们这个就是 UCI 这个项目呢，是在我们所有的全国所有项目里面呢，是亚裔人参加的这个比例最高的。
And this summer, my group will start a new study where we'll try to enroll 75 older Asian Americans, 75 older Hispanics, 75 older African Americans, and 75 non-Hispanic whites for a simple interview to try to understand cultural roles in some aspects of prevention research. And so at UCI-Mind, we have studies ranging from simple interviews all the way to medications that aim to prevent disease in aggressive therapies, and everything in between. And for all of those studies, diversity is key.
好，举个例子呢，就是说我们的一个新的项目呢，就是要就是简单到只是一个 interview， 只是一个对话，或者是问一下一些问题。那么从对话简单的到最后呢是药物测试，那么 UCI 呢都有这些。那么在所有的这些研究当中呢，我们都希望能够包括各个族裔、各个种族的人。Question?
Yeah.
Okay. You have a good motivation person who might have Alzheimer. But one problem we didn't consider is this kind of people maybe already have some kind of problem. They cannot drive by themselves.
Cannot drive by themselves. Yes. So I think the issue, the question, comment is that sometimes there are challenges for a person to enroll in a study. I'm making the argument we need more people to be in studies, but there are barriers for many people. They include transportation barriers. I wrote a paper last year about how we more often exclude non-Hispanic, anyone who's not Hispanic white from one particular type of study. We are trying to be better about that. For many of these studies, we will actually pay for car services. We try to reimburse for gas. Gas is, you know, I think it cost me like $100 to drive here today because gas is so crazy. We all need electric cars. But we are working hard, and it is study by study. But we are always willing to try to find ways to make it easier for people to participate in research. So we've used Uber and Lyft in some studies. We know that's not a perfect solution, but we are always looking for ways to make it easier for people to enroll. And we also, I teach, believe it or not, I teach all of the research ethics at UCI for anybody on an NIH grant to do biomedical research. And in the ethics world, there's debate about paying people to participate in research. And I think it's a faulty debate. We don't always have the budgets to pay people to participate in studies, but I think we should strive to compensate people for the contributions they are making to our research. So for some of our studies, that means making sure people don't have to pay for parking. No one ever pays for parking when they come participate in our studies. Sometimes we pay people a fair wage. You know, in the big clinical trial, we give people $50 for every visit that they have to come to. And that's a lot of visits, so it actually adds up over time to be a significant amount of money. But maybe we need to do more than that, especially if we want people who say no to research to switch to being a yes. Maybe we have to pay more than a fair wage, more than minimum wage. Maybe we have to really incentivize people. We've studied that a little bit, and we always strive to make it easy for people to say yes through minimizing barriers and offering incentives to the extent that we are able. Thank you for the comment. Yeah.
刚才你有列出来5种那个 Alzheimer FDA approved 的那个药，那我的邻居也在用，那我想知道它那个是不是可以减缓那个 Alzheimer 的速度？
Are you asking all of the 5 or just 1?
That's okay, I can answer about all 5. Well, what's the question?
5 medications.
Yeah.
Whether they slow down.
They do not.
Slow down. Huh?
So yeah. So in history, the FDA has approved six Tacrid, and now Adicanumab. None of the drugs that FDA has approved for Alzheimer's disease have been demonstrated to slow the disease. None. So I can name the medications again, and I'll give you their generic name and their brand name. So there was a drug, the first ever approved drug was called Tacrin or Cognex, and it caused problems in the liver and it's no longer used. Then came donepezil, which is also called Aricept. Then came rivastigmine, which is also called Exelon. Then came galantamine, which is also called galantamine is also called, hang on, it's on the slides. What is galantamine also called? I'm not good with brand names. Razidine. Galantamine is also called Razidine. Those three drugs all work more or less the same way. Our brain works by sending chemical signals between cells. One particular chemical seems to be lowered in Alzheimer's disease. Many are actually, but one called acetylcholine was identified early as being reduced. And the way all of these drugs work is that they prevent the degradation of that chemical by an enzyme called acetylcholinesterase. So they are all acetylcholinesterase inhibitors. Sorry, it's a lot of jargon. But they sort of artificially elevate the levels of this chemical in the brain. They don't affect that the disease is hurting the neurons that make that chemical. So they mask the symptoms when a person takes the drug compared to if they weren't taking the drug. These studies have been done. If you had two groups of people who were taking those drugs or placebo, you follow them over time, the people getting drug will do a little better than the people getting placebo. If you take the drug away, you can't tell who got it and who didn't. The history of the disease is unchanged. So they're good drugs. They help. They just don't slow the disease. Those three drugs, the cholinesterase inhibitors, are all approved in mild and moderate disease, and Aricept and Exelon, I think, are approved in severe disease as well. Namenda, or memantine, works on a different chemical system. It works in a different way. It targets a receptor and tries to bring the receptor sort of back in check as the disease progresses. It didn't work in mild disease. It only worked in moderate and severe dementia. And so it's only approved there, but it's the same story. While a person is taking the drug, they do a little better on symptoms of their later stage disease, but it doesn't slow the course of the disease. And all those drugs were tested in earlier stages, what we call mild cognitive impairment, many, many years ago, and none of them, there was some signals, but they didn't get FDA approval for treating mild cognitive impairment, and certainly none of them are believed to work as preventative therapies. Adicanumab is a class unto itself. Instead of targeting chemicals in the brain or the receptors of chemicals in the brain, it targets the disease biology. And many of us think that that is good and important, but it hasn't yet been shown to actually slow the disease. It's been shown to pull those plaques out, and maybe that's good, maybe it's enough, but the evidence just isn't there yet. So the FDA approved the drug, but said you need to do another study to show us if that actually matters. And they're supposed to be doing that study now in people with mild cognitive impairment and mild dementia. And then again, the drugs that target the plaques directly, and there are many, there's Adicanumab, Dynamab, Gantenerumab, Lecanemab. They're all monoclonal antibodies against the beta amyloid protein, and they're all, except Adicanumab, they're all being tested as possible preventions now. It's a lot, I know, I'm sorry. Oh, and there's no way Robin's going to translate.
No, they understand.
Yes, sir.
Yeah, in the diagnosis and the treatment of diabetes, there is the pre-diabetes stage.
Yeah.
How about in Alzheimer?
That's the goal.
Or
That's the goal. So the question is, in diabetes, diagnosis and care, some people get a diagnosis of pre-diabetes. Your blood sugar levels make us worried that if we don't fix this, you could end up with diabetes. And of course, diabetes is a problematic disease. It's the leading cause of blindness and amputation in this country. So that's our goal. I think we usually use an analogy of cholesterol, right? If you go to the doctor and he or she says your cholesterol is too high, in particular your lousy cholesterol, your LDL cholesterol, if it's too high, then they want to put you on a statin, a cholesterol lowering drug. Do we really care about your cholesterol? Only because it seems to be predictive of bad things happening later, like a heart attack or a stroke. And so maybe someday, when you turn 65 or 60, you'll go get your blood test to see if your amyloid levels are increasing so that we can start you on an amyloid lowering drug so that you don't have a brain attack in the form of dementia. That's the goal. There's a lot of work left to be done, but the diagnostic technology is changing fast. Those blood tests, again, the first one has entered the clinic. More are close behind. The treatments need to come along now too. And maybe we'll get there in the next few years. I hope so.
好的。
Oh, right, sorry.
这个就是刚才呢说到说是这个你诊断，你比如说是你的这个什么糖尿病可以诊断了以后呢，你是 pre-diabetic， 就是你是之前那么可以用点药来防止你真正变成糖尿病。那么阿兹海默症可不可以有这种情况呢？就是说是在知道你有这种倾向，然后给你个药呢，然后制止你今后变成这个疾病。那么就是说现在讲到的刚才这个单克隆抗体那么它呢就是有这样的一个，就是如果从血液上研究，从血液里面测试到，哎呦，你的这个淀粉蛋白在里面很高可能也会得这个疾病。那么这个时候呢，我们就给你一种药，如果有这个药的话，那么就可以这个吃药，就像你吃其他的防治你的这个胆固醇那些药吃了以后呢，就不会到的时候成这个病了那么这个呢，就是一个研究的目标，希望呢能够达到这样一个目标。
Yes. Right. Yeah. So this was, again, part of the controversy. The question is that Adicanumab is very expensive and it's not covered by Medicare or insurance. This is a big part of the controversy. The original price was $56,000 per year. And that didn't factor in anything except the drug. And the drug is infused directly into the bloodstream, so there would be added costs. There are a lot of MRIs that are required to make sure that a person is not having a negative reaction to the drug. Again, we think that's a manageable side effect, but it's still something you have to be careful about. So some groups tried to estimate how much it would cost. They came up with $100,000 per year. Right before CMS was going to make their decision, the company cut the cost of the drug by half. They said, oh, we're going to charge $28,000 instead of $56,000. It didn't matter. Medicare said, we're not paying for it. This will be important to figure out for these drugs if they're going to be used. They need to demonstrate they work first, and we're not there yet. But one of the other drugs that's being developed, Dynamab, being developed by a different company called Eli Lilly, tested a different hypothesis. In their clinical trial, they treated for 1 year and then they stopped treatment. And actually, they only treated people for a year if they didn't get their plaques out of the brain. If your plaques were cleared from the brain, they switched people to placebo. And they basically wanted to know if getting the plaques out was enough. So the Biogen model is you keep people on this drug for monthly infusions for the rest of their life at a very high sticker price. The Lilly model is we clear the plaques from the brain, and then maybe you come back every year to see if the plaques come back, and if they do, we treat you again. It's a much more economic approach. We actually don't know if that will work. We don't know if any of these models will work. So there's a lot of work to be done, but wouldn't it be nice if we could just get the plaques out and then you come back 5 years later to make sure they haven't come back? And in particular, if we can catch people even before the memory problems begin, then you go get your couple of treatments, come back in 5 years with a healthy memory, see if the plaques have started to come back again and get treated again. I don't know what's going to end up working, or if any of this will end up working. That's why we have so much work to do. Are there any more questions? Yeah. We love inappropriate questions. So the question is that in Alzheimer's disease, especially late stages, we think of other symptoms that are actually perhaps the most challenging symptoms through the course of the disease. Delusions, hallucinations, aggression, agitation. So these are very important aspects of this disease. They place tremendous burden on caregivers who are trying to help their loved one with this disease. Essentially, every person with Alzheimer's disease will develop these symptoms at some point in their course of their disease. Early in disease, we think of things like apathy, depression, and anxiety. Later in disease, we think of those more overt, challenging symptoms. Increasingly, we recognize that those symptoms, those cluster of symptoms that we sometimes refer to as behavioral or neuropsychiatric symptoms, they don't have to be late stage. They can happen early stage, and some believe they may happen even before memory problems in some people. And there's a growing effort to study what's known as mild behavior impairment. The notion that if a person in their 60s or 70s gets depression, maybe it's not a psychiatric condition, maybe it's the first symptom of a neurodegenerative condition like Alzheimer's disease. And we actually have one of the world's experts on that at UC Irvine, who's a geriatric psychiatrist named Dr. David Salter. And so there's been great work happening in our group to understand these things. And of course, the other thing you can't leave unsaid about these symptoms is that there are no FDA-approved treatments for the behavioral symptoms. Antidepressants don't work that well for treating depression in people with Alzheimer's disease. There's some indication that they may work a little better for treating agitation, and there's studies ongoing for that. There are some other exciting treatments that are being developed and being tested for the behavioral symptoms. There was a very important paper last year that methylphenidate, Ritalin, might actually help treat apathy in people with Alzheimer's disease. It requires more study. I'm part of a study that's testing THC and CBD oil as a potential treatment for end-of-life agitation in people with dementia. So there's a lot of work in this space, and it's all necessary and important. Sorry.
Yeah, it's very long, but so the question is 就是把这个精神症状和神经这个是神经方面的疾病把它分开哈。就是有些呢精神症状呢是早期，看 Dr. Gril 讲的，早期的呢是一些比如说是抑郁症啊，还有对事情不感兴趣啊等等这些。那么有些人早期是这样，那么晚期人就是幻听幻视，我们是说的，就是妄想癔症、幻听幻视，那么这些，那么到底它是属于精神症状呢，还是属于阿兹海默症呢？这个呢，就是有研究呢要还在进行一些研究，就是特别是你刚刚开始出现的时候，比如说是抑郁症，那么它到底是因为阿兹海默症的前期呢，还是因为是一种精神性的一个疾病？好，那么这些呢都是要请专家，要看专家的，就是说要把它分清楚，因为呢这个呢有些呢是当然是精神疾病，有些呢是属于那个比如说阿兹海默症呢是你的大脑的一个神经系统，这个神经这些受到了损伤以后， 那么它的病因是不同的。
The question is, does taking a long-term medication trigger or increase risk for Alzheimer's disease? And the answer, the extent we understand it so far, is no. There are some studies that have suggested some drugs may increase risk, but there are usually equal numbers of studies that fail to find that increased risk. Maybe the most famous studies along this line was studies of replacing hormones in menopausal women. Still controversial about whether hormone replacement therapy is a good thing or not, including for cancer risk, but also dementia risk. And I would say that, you know, that's an individual decision a person has to make with their provider, a woman has to make with their provider at that time. My reading of literature is that the risk is greatest when you wait too long post-menopausal. If you're going to replace hormones, you want to do it perimenopausally. But there's not super convincing evidence on either side about hormone replacement as a protection against dementia. You know, again, I could give you lists of studies that have suggested findings, but nothing has been, to me, convincing that certain drugs either increase risk or decrease it. And, you know, things like the statins have been tested for protective effects. And, you know, I don't think there's adequate evidence for a person to take a statin unless they got high cholesterol. Then it's a good idea. But as just a preventative approach for dementia, there's not adequate evidence.
好，那么就是这个讲到也长期使用某种药，就是刚才讲到的是 sleeping 是吧？就是比如说是安眠药啊之类的，那么会不会引起或者是更加剧你的一些，比如说是抑郁症啊，还有阿兹海默症啊这些？那么回答呢是不会，因为呢现在有些研究呢说是，哎，这些研究有些小的研究说它可以，它有这种会引起，有些说不会引起，但是呢总的来说呢就是没有确切的证据来表明它会引起这些东西。
Yeah, sorry. To say again. Yeah, I heard some German doctor and conventional wisdom say Ginkgo, you know, has some effect on any scientific.
Yeah. So the question is about Ginkgo Biloba. And the answer is no. There was a very large, difficult, expensive study to test Ginkgo Biloba as a possible prevention for Alzheimer's dementia, and it was very convincing that Ginkgo does not lower one's risk or prevent Alzheimer's at all. And no supplement has ever been shown to have risk-reducing benefits for Alzheimer's disease. No supplement has ever been shown to have a benefit for people with Alzheimer's, mild, moderate, or severe dementia. Save your money. Eat a healthy diet. Exercise regularly. Challenge your brain. Learn a new language, like I should. Learn a new musical instrument. Socialize. Stay social. These things have far more evidence for risk-reducing properties than any dietary supplement or vitamin. And of course, talk to your doctor about these things. Vitamin E at too high a dose increases risk for cardiovascular disease. We don't have rigorous studies of most supplements for things like interactions, especially interactions with prescription medications. So there's reason to be cautious, and there's not reason to be optimistic about these things as potential preventative treatments.
好，简单说呀，就是讲到保健品哈，保健品。刚才您说的这个是不是银杏啊？就是这个大家都觉得听了很多，觉得到底有没有用？回答是否定的啊。那么又就是因为现在没有什么研究来仔细的看这些保健品是不是哪一种保健品对这个疾病有什么用处啊，或怎么样？到现在为止就是没有这样的用处。那么 Dr. Gril 的建议就是说是，那么研究表明，就是我们呢锻炼身体。吃健康饮食，锻炼你的大脑，学一个新的东西，就是不断的刺激你的大脑。那么这些呢，反而是证明是有效的。
This disease is
另外一种语言呐，好，它就是学钢琴一个 instrument 啊，你从来没有学过这个。
大都在。
Let me say one other thing. This is a terrible disease. This disease is more feared among older people than cancer. There are people out there with letters after their name like me who are willing to take advantage of people's fears and desperation. There's no quick fix. There's no treatment that the world is hiding from millions of people. And in particular, if someone is trying to sell you a cure at a high price, and many people out there are, they are likely taking advantage of your fear or desperation.
就是说这个疾病呢，有很多，因为我老年人来说呢，就是害怕这个阿兹海默症比癌症是吧？就是更担心阿兹海默症比起癌症来。那么就是有很多人呢，社会上有很多就利用大家的这种心理，那么就来卖，什么药啊可以治这个病了，怎么样？所以我们大家呢，这个是一定要提高警惕的。
I have a challenge.
Great.
Lately I got some information from the President Irvine. So we know that in hippocampus there are regeneration from neurons.
Yeah.
And some now came aggressive exercise, not physical exercise, brain exercise.
Yeah.
Like we say about different language. What is the latest status on the issue of regeneration of neuron in the hippocampus to help?
Yeah.
Memory.
So the question is, for a long time, there was a dogma in neuroscience that you got X number of brain cells, and that was it. Don't lose any, because you can't make any more. And about 30 years ago, the discovery was made that in the adult brain, there were certain regions that could give birth to new brain cells. Even in adults, although the rate, it's called neurogenesis, the rate of neurogenesis went down with age. But still, adult brains could make newborn neurons. You want to say that?
OK， 就是说刚才这个问题呢，就是说有些这个成年人的或者是老年人了哈，成年人以后这个大脑细胞是不是还能够再生呢？那么刚才Dr. Huang 提到，就是说是这个在你的 hippocampus 这个地方，海马区就是你的记忆产生，就是记忆存储的短期记忆存储这个地方，如果能够新生的一些神经元就是再生的话，那么是不是能够解决这个问题的？那么很多年前呢，就是科学认为呢是不行了，人到了一定的程度，这个大脑的细胞就不能再生了。但是30年前呢，有研究表明人到了成年人以后呢，还能够在某些大脑的区域呢，还能够你的细胞还能够再生，只不过呢，它再生的数量啊、程度啊、速度啊可能慢一点，但是它是能够再生的。
Yeah, and in particular, the parts of the brain where this happens are important to smell and memory. And the question is, and many have it, can we manipulate this to make memory better or to treat Alzheimer's disease, a disease of memory? And the answer is, I don't know. There are companies trying to do this. There are certainly many labs trying to learn about manipulating neurogenesis through molecular pathways, including in people who are suffering from brain diseases. And I've been a part of some aggressive studies using technologies that do similar things, but I don't know yet. We don't know yet. I mean, I'll come back to one last thing.
好，那么现在有些实验室啊，有些公司啊，就是要利用这个机制，就是说，哎，脑细胞再生，那么能不能够就是在你的某个区域，就是管你的嗅觉和你的记忆，那么这些区域如果能够来控制这个细胞的再生，利用这个细胞的再生，然后呢，能够来治疗这个疾病，有没有这种情况，有没有这种可能性呢？因为现在还没有证据表明，是有很多机构在进行这方面的实验。
Anybody listen to NPR, National Public Radio? There was a story a couple weeks ago about a colleague of ours at Stanford. They've done 2 impressive studies in mice, and they've begun doing some studies in humans, of taking first young blood and now most recently young cerebrospinal fluid and injecting it into old animal models, including models of Alzheimer's disease, to see if the young blood or the young CSF or factors they've tried to identify the specific factors that they find in the animal models that they can make the brain young again. The fountain of youth finally discovered. There's a lot of work left to be done. But they did do a first clinical trial of plasma exchange from young plasma donors into older people with Alzheimer's disease. It was a small safety study. Not surprisingly, it was safe. Plasma exchange and blood donoring has been used for decades. So a lot of work left to be done, but tantalizing preliminary findings in the mouse. Now, UCI is the home to multiple mouse models of Alzheimer's disease. There are multiple models that have been discovered at UCI, used worldwide. My friends and colleagues who discovered those mice will be the first to admit we have cured Mouseheimer's many times. What we need are cures for the human condition.
好，那么刚才这个稍微解一下，就是说刚才举了个例子，就说是斯坦福的一个研究人员哈，他们在老鼠身上就是用那个就是年轻的血液和那个脑积液，那么输到老的动物、老鼠身上，那么是看到一些效果了，但是呢，这个呢需要很多的工作。那我们 UCI 呢，实际上是我们的最先的这个老鼠的得这个阿兹海默症这个 model 啊，这个老鼠呢是学校里边的一个教授做出来的。那么他做出来这些，那就是用了很多实验室都在用他的老鼠。那么在老鼠身上呢，好像已经治疗这个疾病了，但是呢，在人身上呢还有很长的路走。
We think education is really key to lowering risk, and for those of you listening in English and in Mandarin, you're getting twice as much education. Any other questions?
All right, I have the last one. Talk about the web. So-called Boston nurses study.
Yeah.
And when they pass away, those old nurses, their brain found a lot of plaque there.
Yeah.
But they don't have a clinical symptoms of dementia.
Yeah.
And so the role of the plaque and cognitive research, it's really the issue of it. Now, I don't think the audience know about that.
Okay.
Maybe we can.
Yeah. So I'm going to paraphrase the question. In autopsy studies, and we have an autopsy study at UCI, we have about 1,000 people have donated their brains to our research over the last 3-4 decades. If you look at people who die in their 60s, 70s, 80s, and 90s, who have normal memory, no dementia, when they pass away, about 30% of them will have plaques associated with Alzheimer's disease present when we examine the brain. And this is actively studied, and there are two sides to this coin. Some people in the field think the disease had begun, but the person passed away before they reached the stages when the memory problems began. Other people feel that those people had something special about them that protected them from developing memory problems, even though the plaques and maybe even the tangles were present in the brain. There's evidence to support both, but I believe that if you have plaques and tangles present in your brain, it's a matter of when, not if. And will some people get hit by a bus or have a heart attack or something else before they get memory problems? Yes. But I think the disease is present. And it's our job to find a way to stop the disease before it gets to the point of causing symptoms. Do I think we should study whether some people have genetic factors or other protective factors? Yes, absolutely. There are people doing that work. But I will tell you that I have committed much of my own work to studying this stage of the disease as the earliest stage of disease and the best time to try to intervene with disease-modifying treatments. And I forgot about translating.
I'll try.
She does. This is also training for her.
Training for me, yes. 好那么这个呢，就是讲到有一个刚才 Dr. 焕也讲到有一个实验表明哈，就是在大脑在过世以后，大脑的解剖呢看了，就是说为什么有些人呢，他大脑这个斑块，就是我刚才我们说的电载那些非正常电载，那么积在里面，但是呢，他们生前呢，就是他们没有出现临床症状。那么 Dr. Gril 讲到，我们在 UCI 呢，有很早呢，就是跟我们一起长期研究的人呢，就捐赠他们的大脑。那么他们大脑解剖的时候，有30%的人都有这种情况，就是说在他们生前的时候，他的这个没有出现临床的任何症状，记忆症状或者什么，他们都是正常的。但是过世了以后一解剖呢，大脑呢，他们就有斑块。如果你光看他的大脑，你就会说，这个人肯定是有阿兹海默症。但是呢，他又没有。那么有30%的这些人，那么不同的理论呢，就是有些人呢就认为在这个病程过程当中呢，就是有斑块这些人呢，肯定在他某个时段，他肯定是要得这个疾病，但是呢，他们还没有到那个时段。但是那个时段呢，是70还是80还是90，这个呢就是不知道了。那么这个呢是理论，一方面的理论。那么有些人的理论就是这些人可能有其他的什么因素影响他们，然后呢让他们有一种保护能力，他们没有表现他们的临床症状。那么 Dr. Gril 刚才讲到的，他是参与的是前面一种，就是说有这个斑块出现呢，在某个时候肯定是会出现症状，只不过呢过世那些人呢可能还没有出现，不管是他60岁过17岁，他可能还没有到80岁，可能还没到90岁，所以是这样一个观点在里面。Good memory, right?
Yeah, very good. We thank you for being here, for carrying on. We're with you. We will be back if invited. And we hope you'll consider enrolling in the CARE registry. There's no risk. Tell your family, tell your friends. We're almost to our goal of 10,000 Asian Americans and Pacific Islanders to do better. We have many studies at UCI. If you're interested, we recommend you look at our website, mind.uci.edu. There's a lot of information, opportunities. education, resources, and thank you again, and we'll see you soon. Thank you.
好，谢谢大家，下次再见。